on the care that sick women receive today. I realized that my relationship to the medical system, like my relationship to my own body, had been very much influenced by my status as a fairly healthy person. Just as I'd had the luxury of not thinking very much about my body until it broke, I'd also given little thought to how well the medical system was equipped to care for me if it did. I'd always known, of course, that there were thousands of ways a body could break. But such theoretical possibilities don't matter much to an invincible 20-something. Likewise, I knew intellectually that doctors and scientists are just infallible human beings affected by the biases we all are, and that biomedical knowledge is incomplete. But as long as I didn't personally have much need of medicine, it was easy to not think about its limitations. But once I started to think about them, I quickly realized that autoimmune disease isn't the only women's health problem that is comparatively neglected. Indeed, it felt like every disease that experts described as an overlooked and often growing epidemic disproportionately affects women. Women make up about 2/3 of people with Alzheimer's disease, which experts now consider the third leading cause of death after heart disease and cancer, though it receives only a fraction of the research dollars. They're at least twice as likely to have chronic pain conditions that affect 100 million American adults, but that are woefully undertreated and under-researched. Then there are conditions like fibromyalgia, chronic fatigue syndrome, chronic Lyme disease, and multiple chemical sensitivities that are 70 to 80% female-dominated and so poorly understood, they have yet to be fully accepted as real diseases by the whole of the profession. Meanwhile, I was somewhat surprised to realize that apart from our reproductive health concerns, medicine pays little attention to potential differences between men and women, instead taking a one-size-fits-all approach to clinical research and practice. Ironic, given that medicine historically had often declared women to be fundamentally different from and inferior to men. For decades, that one size was specifically a 70-kilogram white man. Women of childbearing age were largely excluded from clinical research, particularly drug studies, altogether. While their numbers have increased since the early 90s, when federal law began requiring women and racial minorities to be included in research funded by the National Institutes of Health, NIH, we are still feeling the legacy of years of foundational research conducted on men, with the assumption that it could be extrapolated to women. And despite a wealth of evidence that has emerged over the past couple of decades showing that that was not a safe assumption, that there are, in fact, plentiful differences between men and women in everything from drug responses to risk factors for various diseases, researchers still don't routinely analyze and report such differences. I also didn't have to look very far to find that it wasn't just women with autoimmune diseases who found that their symptoms initially weren't taken seriously by healthcare providers. Just a quick survey of my own network revealed that women with a wide range of problems were similarly dismissed. For a month, multiple healthcare providers insisted that one friend's stabbing chest pain was likely just anxiety before they realized it was pericarditis, an inflammation of the lining around the heart that causes symptoms similar to those of a heart attack. 2 OBGYNs attributed the abdominal pain and incontinence of another's ureaplasma infection to stress, when another friend complained of dizziness, wooziness, ringing in her ears, and floaters in her eyes. An infectious disease specialist suggested that she see a therapist. It turned out she had West Nile virus. The list went on. Anecdotes like these abound on the internet, too. Often, women's symptoms are brushed off as the result of depression, anxiety, or the all-purpose favorite, stress. Sometimes they are attributed to women's normal physiological states and cycles, to menstrual cramps, menopause, or even being a new mom. Sometimes, other aspects of their identity seem to take center stage. Fat women report that any ailment is blamed on their weight. Trans women find that all their symptoms are attributed to hormone therapy. Black women are stereotyped as addicts looking for prescription drugs. Their reports of pain doubted entirely. Whatever the particular attribution,